Hello everyone, this is Paul from Ortho Eval, pal, and I just thought I'd start with a little funny story here. We're doing all this videotaping, having a great time identifying these different areas, and I was just doing a recent live Facebook post about a tree farm that I have and how to take care of your trees and stuff like that. And I had two cameras set up, and the wind came by, blew the camera funny, and basically the cameras were going two different directions. I continued talking for 5 minutes, and it was just recording blades of grass. So, you know, crazy stuff happens when we do videos, and I hope you're enjoying all the videos that we're doing, and it's really all about giving some education, learning more, getting back to the basics of proper orthopedic evaluation. So today, sorry about the big intro today, but we're going to talk about an L3 nerve root compression, okay, and what that looks like. These are very tricky. Patient comes in, they have anterior thigh pain, it gets pretty achy, they walk for a bit, it seems to get worse, they sit down, maybe it gets a little bit better. That could be many things. It could be anything from a vascular occlusion at the femoral iliac artery. It could be a grade 3 hip arthritis causing pain down to the anterior and medial side of the knee. But an L3 will present with anterior thigh pain in this area. Now L3 does not have a reflex, okay? What you need to do is you need to assess if they have any loss of sensation over the anterior thigh. But most importantly, is hip flexor weakness. So you keep your hands on the table. I'm going to have you lift this knee. Okay, hold it right up in the air. Don't let me push it down. And if he had an L3 weakness, go ahead and lift this one. This one would just give out and go right down. And it's pretty impressive. They really think about holding it, and they really can't. If it's a hip arthritis, they typically can hold it, but it'll cause pain in the hip. If it is a L3 nerve root compression, they hold it, but it's more like giveaway weakness. There just really isn't a lot of strength there, but not very painful. So think about that. Nerve type problems usually offer painless weakness, okay? Something else you need to remember, I'm going to have you lie right down if you would for me. Something else you need to remember is that when you do a straight leg raise test to identify nerve root compression or neural tension, L3 is a little bit higher. So when you do a straight leg raise test, you're not going to get as much neural tension from that. So you can have a large L3 herniated disc and have a negative straight leg raise test or a negative Laseg sign. Okay? So don't look at that and say, oh, he doesn't have a straight leg raise test, so he can't have a herniated disc at the L3 level. That's not true. Loss of sensation, pain anterior thigh, and weakness of the hip flexor are the telltale signs of a herniated disc at the L3 level. Thanks.